Hello, it's Medication Monday. This week I want to talk about Vyvanse.
All right.
All right. So what is it?
Vyvanse is an ADHD medication. It's an amphetamine that is FDA approved for the treatment of ADHD. And in ADHD treatment, there's kind of three camps. You can either take Adderall or its derivatives, or you can take Ritalin and its derivatives. And then there's like non-stimulants like 10X or guanfacine. And kind of in that package too is like Wellbutrin or Strattera. So Vyvanse is most closely to the first bucket, which is Adderall derivative. And what makes it different than Adderall is that it has a little amino acid on it that it's attached to the active molecule. And when you consume and ingest Vyvanse, your body over time, there's a little enzyme in your red blood cells that cleaves or breaks this apart, kind of in a natural way, and then activates it. So I like to think of it as a little army of men and women there pulling the pin on a grenade and then throwing it and have it work. And they can only have one grenade at a time to pull it and throw the grenade. So there's kind of a longer action in your body because of that. And that's important because when you take something like Adderall in immediate release form, you get a big bolus of the medication all at one time. And some patients, they just don't like it or they don't handle it as well. And it might be more like a flash in the pan rather than having longer action. A lot of times Vyvanse patients describe it to me as being smoother of an experience, and it lasts a bit longer and it has less of a crash. Now, again, this is not medical advice for any one particular person. You should ask your doctor about it. But those are the general differences between Vyvanse and like the Adderall itself.
Oh, I got it. So it doesn't cause anxiety. It doesn't make you jittery.
No, it can for certain. It tends to be smoother than not all the time. I mean, remember, every person can have any response that their body wants to have to something. But if someone's really jittery on one medication, I might try Vyvanse for that patient. And so it can make any stimulant for that matter can make somebody jittery, cause insomnia, cause lower appetite, cause heart palpitations.
Okay. And is it addictive?
Yes, it's a Schedule 2 medication. Schedule 1 would be like cocaine or heroin. Schedule 2 is Vyvanse, Adderall, things like that. Schedule 3 is like benzodiazepines like Xanax and Klonopin. Schedule 4 would be like gabapentin. Just generally from memory, what I think. And so the higher the schedule, the more habit forming technically could be. Most folks, though, who take these stimulants, in my experience, they perform better in life because they can focus and complete work, and they feel like they're on top of their work and they're succeeding. And once they have that, by taking one tablet a day or a tablet twice daily, depending on what they're prescribed, they don't really need to take more. And a lot of patients tell me that they don't enjoy the experience beyond what it does for studying. It's not like you want to take one and go, hang out with your friends or something. Some patients tell me that they feel too mechanical or a little robotic on it. They're less personable. They won't joke as much. And if you could think of folks with like ADHD that's more hyperactive type, a lot of these folks are playful and they are spontaneous and they can tell good jokes maybe, or they can jump topics quickly. Whereas the medication that calms all that down and will limit that.
Okay. All right. Well, thank you very, very much.
Okay. That's it?
That's it.
Okay. Very good. Thank you. Appreciate it.
All right.